All right, I hope all of you are doing well today during these especially extraordinary times we're in. I want to thank Green and CKON for making some time for me today to provide the community with an update. It has been 3 weeks since we declared a state of emergency for Akwesasne, and we continue to monitor the global and local situation daily regarding the COVID-19 coronavirus. I know this is a very difficult time for all of us. We're dealing with an event that we never thought we would have to deal with in our lifetime. And I know many people are feeling uncertain and are scared. I want to reassure you that together as a community, we will get through this. But in order for us to minimize our risks, we all need to take this serious, and every person in our community needs to do our part. Our youth need to take this serious. To our youth, you need to social distance and stop running the roads and stay home. Your exposure to others places you and your family at risk. Individuals returning to our community from outside of the 50-mile radius must quarantine for 14 days. Again, this is to keep everyone, especially our most vulnerable community members, safe. We all need to social distance and stay home. The only travel should be happening for essential reasons. We have been working closely with the border officials to ensure that the border remains open for essential travel, but we want to continue to ensure that the border remains open for our community members, but this is for essential travel only. We must all take this situation serious. Visiting at other people's homes, including your extended family members, puts you and them at risk. Now is the time to be using the telephone and other video options such as Facebook, WhatsApp, Skype, Marco Polo, Facebook Messenger. There's lots of ways to connect with our family through social media and other video means. And we can't be doing this in person. We need to keep in touch, think of others, and talk to your kids, but stay home and stay safe. This is extremely important for our community to embrace this. The recent numbers of positive cases for COVID-19 currently in Franklin County is 59. St. Lawrence County is 59, Franklin County is 10, and the Eastern Ontario Health Unit is 44. I'm giving these numbers today to the community to help you understand how real this is. We need to take COVID-19 seriously and do our part to ensure these numbers do not continue to increase. I know that the warmer weather is upon us and we all want to be outside, which is fine, but we must still social distance when we're outside. Remember, this is to stop you from getting the virus or you giving someone else the virus. People can transmit this virus without even knowing they have it because not everyone develops symptoms or timely symptoms. Easter is fast approaching now. This is a time for usually families get together. However, during our current state of the pandemic, it is extremely important that people remain at home. I know this is not easy. We need to maintain physical distancing as well as not allow gatherings of more than 5 people. This is extremely important. Again, the symptoms don't develop right away. People may not know that they have this. I'm also calling on all businesses in Akwesasne to do their part. Your staff should be trained and protected. Community businesses should be ensuring that customers are social distancing and protective equipment should be available and used by staff. Businesses that are not essential in our community need to be closed. We need to all do our part in protecting our community. Myself and other members of our council participate regularly in calls with federal, provincial, and regional First Nation agencies and governments to receive updates and learn more about the different approaches and programs available. This is all in an effort to protect our community and the globe in which we live in, as well as to stop the spread, slow the spread of the COVID-19. Here at the MCA, we continue to share much of this information on our social page, on our social media pages, Facebook, our website, and also now on our regular email updates. I know that many people in our community are concerned about meeting the ends financially. As of right now, no Mohawk Council of Akwesasne employee has been laid off. Many of our employees are on stand-down status, and all essential workers are continuing to work to keep our community safe. I want to thank all of our employees for doing their part. The latest edition of Untitled Chapter has the most up-to-date listing of MCA programs, their statuses, meaning whether they're operating or not, or how to contact them. Please review this. We continue to share program information and links on our social media page about various government programs that are available for those who are out of work or unable to work. Please take a moment to look up these programs or reach out to the MCA for more information. Our Department of Health receives regular updates from various health agencies, and they're working to ensure that we're prepared for the COVID-19 virus. The recommendation for the general public on wearing masks in public, according to Public Health Ontario, is if you are healthy and a healthy individual, the use of a mask is not recommended for preventing the spread of the COVID-19 virus. Wearing a mask when you are not ill may give a false sense of security. There is a potential risk for infection if you're improperly using the mask and disposing of it improperly. However, your healthcare provider may recommend you wear a mask if you are experiencing symptoms of COVID-19 while you're seeking or waiting for care. In this instance, the masks are an appropriate part of the infection prevention and control measures. The mask acts as a barrier to help stop the tiny droplets from spreading when you cough or sneeze. We will continue to keep the community updated as we work towards the establishment of a COVID-19 assessment center. This center will be available for individuals concerned with their COVID status and to get tested. More information on this will be forthcoming from our Department of Health. Anyone who is experiencing symptoms of COVID-19 should immediately self-quarantine and call MCA Community Health at 613-575-2341, extension 3220. Very important that you don't come in, you must call first. The Eastern Ontario Health Unit as well is available at 1-800-267-7120 or email info@eohu.ca. As we reported last week, we have set up a food distribution system to support the community. Even though this Friday is a holiday, we are still going to continue to have the community pickups. The food distribution schedule is for Tuesday is home deliveries for AMD students and some elderly who have called in, as well as ACFS clients that have been identified by their MCA worker. Friday is for community pickups at each district school. From 11 to 11:30 is for elders only. 11:30 to 1:30 is open for the rest of the community and until all food boxes are gone. Remember to stay in your vehicle, ensure social distancing, and that only one per box per vehicle will happen. I want to thank the local businesses in the community that have donated boxes of gloves, masks, boxes, hand sanitizers to the frontline workers that are helping with the food distribution. Now on to you guys. Also, an update from the Akwesasne Board of Education. Post-secondary continues to accept online applications. You can reach out to the office. Our numbers are listed online. Again, that's post-secondary, college, or university. Applications are still being accepted for the fall semester. Yohahio has moved all our courses online and they're completing the semester. Yohahio can also be contacted through email. AMBI is collaborating with CCVS and TR Leger to prepare a learning path for all secondary students. So high school, they're working on ensuring that the high school students are taken care of as well. Sandra Rourke is the contact for that. The elementary schools were preparing for distribution of Chromebooks for students who require a device to participate in online learning. We're working with our literacy partners to have reading material available for students electronically. AMBI teachers will be reaching out to families to arrange online meetings with small groups of students. We realize that not everyone has some access, therefore there'll be no penalty for if you're not able to participate. Our school counselors are also reaching out to our parents and staff to provide support to the families. AMBI continues to respond to inquiries by email, phone, or through Facebook Messenger. Again, our Emergency Operations Center for the MCA is operating 9 a.m. to 6 p.m. from Monday to Friday, and you can contact them by phone at 613-575-5005 and 613-575-2331, or by email eoc@akwesasne.ca. It's important to write this information down and also to follow our Facebook pages to be able to continue to receive information from the EO. EOC. Again, I want to thank you for the opportunity to provide the community with an update. Thank you to Reen and the crew at CKON for allowing me to do this today. As well, again, thank you to all of our first responders, our health professionals who are working hard to ensure that we keep our community safe. And for all of us, we need to continue to do our part and embrace the social distancing, frequent hand washing, and we really need to stay home. Reen, that's all I have for this morning. I'm open to take any questions that you or the community may have at this time.
All right, thank you. Again, that's Mohawk Council of Akwesasne Grand Chief Abram Benedict with our COVID-19 updates for the jurisdiction of the Mohawk Council of Akwesasne. So if anybody has any questions, you can call us at 613-575-2101, 518-358-3427. This is a live edition of Dead to Watala. And one question from a community member. They share a concern about the way that MCA is doing the food distribution. The listener wants to know, are the people being careful who handle the food? Would it be better to hand out checks for food instead of the actual food?
So at this time, the staff are taking all precautions in the receiving of the food in bulk and storage of it, as well as ensuring that they've all been sanitized before they go off. That's where we thank the community for providing gloves and other essential materials to keep the workers safe, as well as those that are distributing the food safe as well. As far as distributing monies to people to help them, it's not something we have considered at this point. The purpose of for the food distribution is so that people don't have to, those who are not able to make it to the grocery store, or those who are elders who are too afraid and not able to make it there, we're making that available to them at home. This is really being done on a case-by-case basis as well. If there are individuals who are concerned about that, I welcome them to call us at the EOC, and we can likely make arrangements for alternative food distribution.
Okay, so again, that's 613-575-5005 or 613-575-2331. Those are the numbers for MCA's EOC. You can also email eoc@akwesasne.ca. Another question from a listener, Abram. Social distancing, people are not listening. This caller feels, should we just shut down everything completely for 2 weeks? Have military patrol, they say.
So this, the atmosphere in which we are in continues to rapidly change day by day. We on our regular briefings with the East Ontario Health Unit. They are providing direction as far as what businesses in the surrounding area should be closed and what should not be. At this time, no surrounding areas from us has closed down. I think it's extremely important that everybody embraces the social distancing, that, people have conversations with their children about the importance of this. This really is a concerted effort that we all need to really embrace. Again, this is changing day by day. We will continue to look at what other options are available, but really we need people to exercise common sense and not continue to gather and share the message. This is a collective effort. This is not just on the MCA or the St. Louis tribe to make sure people are doing the right thing. Everybody plays a part in this, but we will continue to keep the community updated as everything develops around us. Things are changing very quickly.
I would like to make sure that people know that 800 number for holistic health and wellness, when we're talking about, making sure that we have enough food and making sure that our kids are trying to keep connected with their schooling and whatnot. And of course, people's behavior and getting kind of cooped up with everybody. People are starting to feel the effects on the mental, emotional, spiritual aspect of it. So we want to make sure you have the Holistic Health and Wellness Mental Health Hotline number. This is 24/7. Someone from Akwesasne will answer the phone, and if it has to go to a voicemail, they will call you right back. It'll be someone from Holistic Health and Wellness Mental Health Program here in Akwesasne that answers it. So please write this number down, 1-844-244-1060. 1-844-244-1060. And today and for the next 4 days, we're going to be airing a piece that we have from Wanyatanola Oaks. And she talks about the actual physical portion of the body and what happens and as it reacts to stress and the fight or flight kind of deal. So it's really interesting, and we're going to be airing that. You can watch the video in its entirety on the MCA Facebook page. We've also shared it on CKON's Facebook page. So that's going to be coming up this afternoon. I aired it once this morning, but she's got some really good tips, and she talks you through it. So it's a good piece for people to pay attention to, please. Now, taking a look at our next question, what does your long-term emergency plan look like? How far down the road do we have a plan for, Grand Chief?
So we are currently right now continue to monitor the situation around us. We are really focusing on ensuring that people are staying home, that people are embracing the social distancing. Extremely, I mean, we may have seen on some of the social media or in the newspaper or on the television, on the news about the curve. Now, the curve is about flattening the curve. Is a real thing, and that is the projections show where the curve is going, but that is the amount of people that are sick and the ability compared to the ability to manage these sicknesses and the systems that support ill people. So we haven't got to that point yet of kind of on the down end of the curve yet. I mean that as a national scope, at least in Canada. Within the MCA as an organization, we continue to brief daily on what the next steps will be, what the new service delivery models may be going forward, because we offer lots of services to the community. What services will be offered remotely, what services, what individuals will be doing, what we are continuing to examine that. We have not made any long-term plans yet. We do know that the focus right now is really on embracing the social distancing, flattening the curve. And that's really where we're at right now. I can assure you though that we are looking at what the long term may be. We're really relying on the projections of the healthcare professionals, the governments, to help us make that determination. So we have not made any definite decisions on what the long term is. Really, it doesn't include much more for the medium term. For the short term is staying home, only going out for essential reasons, social distancing, not being out visiting your neighbors, your family members, because we really need to be at home and protect ourselves. That's where we're at.
Is it possible to, another listener wants to know, is it possible to instill a curfew in the 3 districts?
So this is something that our council has had many conversations about. We do have a video conference call 3 times a week to receive updates and brief and to discuss strategies or initiatives that are ongoing. The curfew has been something we have chatted about. Based on what we're receiving from the information we're receiving from our police services, is that at a certain point in the evening, the people that are interacting on the roads or are off their property or out doing things really is really low. So putting a curfew in at this time, people already essentially are curfewing because there's no stores open after 8 o'clock. People should be only moving around for essential reasons. This is a very rapidly changing situation. We have not ruled out a curfew at this point, but for the most part, people seem to be not out and about after a certain hour, which is a bit of a self-imposed curfew that the community has done. Now, will we move into that direction later on? It's quite possible, but that is why it's extremely important that people take this serious, not allow people to visit them in their homes, because there's a risk to that. Have conversations with your loved ones, your children. Let them know that this is a serious situation. It really is about all of us doing our parts to make sure that we limit our risks and slow the spread into our community, because this is a dangerous situation and we need to be serious, but we all need to do our part to keep each and every one of us safe.
We're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. We're providing some COVID-19 updates. He provided some information at the beginning of this program, and we are live. So if you have any questions, let's get those in, because we've only got a little bit longer here. 518-358-3427, 613-575-2101. Now, when we look at the fact that we're trying to do our best with the social distancing, we're trying to do our best with the stay home. When it comes to, say, someone does end up with COVID-19 under the jurisdiction of the Mohawk Council of Akwesasne, have you had conversations with outside entities where we would go to the hospital if needed? I know that we always know that 80% of people that contract COVID-19 that test positive have mild symptoms. But then there's the other 20% where they might need hospitalization or they might need a ventilator, things like that. Are we going to Cornwall Community Hospital? Are we going to Alexandria, Winchester? Has any of that been discussed, Grand Chief?
Yes, so our health folks here at the MCA are in regular contact with East Ontario Health Unit, who is in contact through their networks. They have regular briefings on the current status of this region. Our local hospital is the Cornwall Hospital, and currently with this virus, people will only be hospitalized if they're in a bad shape, in need of constant medical attention to be able to ward off the virus. Most people will have to isolate and be at home and not interacting with anybody to ensure that the virus does not spread to others, but the local hospital, Cornwall Hospital, will be the place that our members will go to. Now, if we get to the point in the region that there is an overflow of the capacity of the Cornwall Hospital, through the Eastern Ontario Health Unit, they have a network which does include other area hospitals, and they're also setting up temporary locations to assist. Is not off the table for any region in our area, because we're seeing in bigger cities not very far from us that the hospitals are overfilling and they're opening facilities to hold people. So this is happening not very far from us. People need to embrace this social distancing, need to stay home, and we all have to do our part in flattening the curve.
And I know that a lot of times when we talk about, anything that's happening around our area and around us, around the world, we see the stock market. So a listener wants to know what happens to the money in the settlement trust. Will it still be there once this is over, even though the markets are crashing? Is that money in the stock market?
Yes. So the what we call the principal, the original monies will always continue to be there. All of our investments are in Schedule 8 banks, which is basically government bonds or instruments very similar. So very low risk. So when the markets have gone down, just essentially means that our returns will be less. Our investments won't go into the negative. Our principals will never go into the negative. So because we're a government and the money that we manage is the community's money, this is your money, and we've always had a mandate for 7 generations. We're very conservative in our investments to make sure that in cases like this, when the markets do tank, that all of our community assets are not liquidated. So we're very conservative at how we invest here at the Mohawk Council. So it's a minimal risk on that.
All right. Again, we're talking with MCA Grand Chief Abram Benedict, talking about COVID-19 updates affecting the jurisdiction of the Mohawk Council of Akwesasne. And when we talk about social distancing, staying away from one another, we want to make sure that we're being very serious about that and very absolute. Have the conversations with your family members. And especially with that holiday coming up this weekend, please do not have any family meals where you're inviting other members other than people that you don't sleep with in your home. Don't invite them over for anything. If you're going to cook, you could go drop something off at your loved one's front porch and leave. That's the safest way to do it. And we, again, please, we ask people do not visit each other's homes. Go inside the home or go any closer than that physical distancing, which is that 6 feet or 2 meters away from people. So we know that people have to get supplies and their medications and just those essential items. We understand that. But all you have to do is pick up what you need, drop it off somewhere, and the person goes out on their porch, they grab it, wipe out everything down, make sure it's sanitary, make sure you're washing your hands before and after, so that everything is followed and every precaution is taken for your health, our community's health, and that we all get through this together. And I know that some of the things that we've talked about, questions from our listeners, Grand Chief, seem to be, things that are happening beyond our control, the way people are not staying home. They might be riding around all night, running the roads, as you mentioned. We have some people that are upset about the shooting off of fireworks in the night, during the night in the village. It's dangerous. How can we put a stop to that?
So we are currently right now reaching out to the Hogansburg Volunteer Fire Department to issue a joint release. People need to be not having fires in their backyard, not lighting off fireworks, not burning objects for social reasons or for any reason at all. It's unsafe. The reason being is that if this fire gets out of control or your fireworks catch something on fire, the firemen then have to respond, and they do not know your current status of whether or not you have the virus or maybe carrying the virus and not know, and then puts them at risk. And also they end up having to respond to the scenes. If there are specific instances of people lighting fireworks off, the Akwesasne Police Service is our police services here in our community. They should be making a call to them, filing a complaint that persons are lighting off fireworks and it's unsafe, and people should not be burning anything at this time.
Perfect. I think that we're going to bring it to a close in the next 5 or 6 minutes. So any other questions, they're wrapping up on the phone right now. We'll get those on for you. Now, Grand Chief, I know that we have the Emergency Operations Center. Again, it's 613-575-5005 or 613-575-2331. And again, the email there is eoc@akwesasne.ca. Once again, eoc@akwesasne.ca. Grand Chief, you had made reference to your council meeting online, doing your, you guys probably use Zoom or some other sort of video format, but you guys do that 3 times a week, you mentioned?
Yes, we do. Currently, we're meeting Monday, Wednesday, and Friday for about an hour to receive updates from the administration and to discuss current concerns from members or the community themselves.
Okay, so I know that we've made reference to a lot of the businesses that aren't essential service businesses, to try and remain closed. So we have one listener who wants to know why the cannabis stores on Cornwall Island are open when provincial government ordered them to not be essential now.
Yeah, so this is something we have received, feedback from. I have reached out to individual representatives of those shops, asking them to, consider closing, because we do know that people are coming from off of the community to go to those places to purchase purchase products from them. They have assured me that they are taking precautionary measures to make sure that there's not people congregating there, that there is protection for the employees. We all know that we've had challenges with cannabis shops in our community in the last little while, and we've seen actions by the community supporting these establishments. And really, this is community driven. We are concerned about this. We're asking them to consider closing. We see that around us there are lots of non-essential places closing. We continue to examine what's maybe available to us, but really we've had the conversations. I've had the conversations with them, and we're hoping that they will make alternative business decisions that will that are mindful of the community and will ensure that the community is going to continue to be safe. So we're in this together, whether or not you're business owners or an MCA employee or work off the reserve. This is our community. Everybody must do their part to make sure we are limiting our risks, stopping the spread. And this is an item that this is a conversation that we're very serious about on with the shops. We're asking them to do the right thing. That's all I can offer for at this time.
All right. So I know that you referenced some of the Government of Canada programs, whether that's provincial or whether that's federal. Are there any plans to have, or are there setups right now, maybe that we can let people know about, with regards to any of the programs or monetary issues that the Government of Canada has set up for people to, if they have children under 12 or if they have, different things like that. We're going to close the phone line, so tell it close. Here, I'll take that. But we're closing the phone lines right now because we are wrapping up soon. But getting back to those Government of Canada programs, do you guys have any people that are working specifically on that, so that Akwesasne that are eligible to benefit from some of these programs, whether it's for people that are sick or at home and can't work, or the EI or anything like that, that are set up now as Mohawk Council of Akwesasne?
So we've received in the last little while a number of questions about programming that may be available either for the small businesses or for individuals. What we're telling the community is that we're encouraging members of the community that may be out of work to apply for the programs that are made available. So they just started yesterday, excuse me, of accepting applications. We're doing our research now on what to be able to inform the community through social media exactly where you may fit in these situations. But we're really encouraging community members to apply for what's been made available. And I believe it's called the CERB, which is the program. I can't think of the name offhand. That's been made available to all people in Canada. Apply. If you're not eligible, please call us here at the MCA, and we'll see how we can work through what may be available for you. We do know though that GST, everybody that has filed, who regularly files income tax, whether they have a taxable income or not, will be receiving additional monies coming up through what they call the GST returns, as well. Those who do receive child tax credits for their young children are going to be also seeing an increase in the coming weeks and months to support families. So really, it's about those who are not eligible for unemployment insurance. They need to be applying for the unemployment insurance first. What we've been told is that you apply for the unemployment insurance, or if you already have, they'll be going, and if you're not eligible, they'll be transferred into the other program. So watch our social media page. We'll be releasing more information on this for the community to be able to receive information, see where they're eligible, and to be able to apply.
All right, so a couple of other questions, and then we'll wrap up. I've already closed the phone lines. So why are Mohawk Council of Akwesasne and the Sibberges Mohawk Tribe allowing people onto the reserve from outside of the 50-mile radius? We have an unusual draw because of our low prices when they could get it in their own towns.
Yeah, so we do have regular back and forths with the tribe with relation to how they're ensuring to keep the southern portion safe. We continue to get calls from concerned persons about non-members coming here to purchase whatever product it may be. I do know that the tribe will be taking actions shortly to limit the risks as far as timing goes on some of their establishments. Within the jurisdiction of the Mohawk Council, the community stores that we may have in Akwesasne or here in Ganadigal, are pretty localized to our own people and are quite essential. Cornwall Island or Gawanoge is a bit more open to Cornwall residents. We've already talked a bit about some of the cannabis shops that are, causing concern. The gas station and that exists there. I've had a conversation with the owner there. They are taking measures as well to ensure that, their employees are safe. Really, people aren't, right now gas is cheap and everybody's thinking that, they should fill up their vehicle, but nobody is going anywhere. So that, it's really about the other products that are being sold. We're examining what other options may be available to us to ensure that we're limiting the risks of non-members coming here to our community. If people as well see suspicious activities happening in our community at establishments that are not that are questionable, I encourage you to please call the Akwesasne Mohawk Police and file a report with them. This is really a community effort to be able to keep us all safe.
Okay. And one other question, someone would like to know, why is the EOC only open Monday through Friday? Is there someone that mans those telephones 24/7, or is that something that can be changed, or why is that?
So currently right now, we do have the EOC only operating certain set hours here at the Mohawk Council. We had been operating Saturday and Sunday. The only calls that were coming in was about food distribution. If the virus numbers continue to increase, we will expand those hours of the EOC for our community. But there is always people available, whether it be members of our council, our health services department are available to be able to assist community on the weekends or in the evenings with issues that may be, that are pressing issues. So they really, the EOC is closed at a certain time, but there are people available to assist all hours if need be.
Excellent. So let's wrap up, Grand Chief. Do you have any closing notes? I don't have anything else on my side. If you could just wrap up for us now.
Absolutely. Well, Reen, I want to thank you again at CKON and the team you have over there for doing a great job that you guys are doing to get all the information you can out to the community, for making the time for me this afternoon to be able to share with the community some updates. There's lots of, the Mohawk Council of Akwesasne is putting out lots of information to the community. We'll continue to do that to ensure that you're aware of the current happenings, what programs are available, what measures are being taken from the organization. We have an incredible health team, essential workers who are here day in, day out, preparing, doing research, ensuring that our community is ready for any influx as well, getting prepared for what may be ahead. We don't know. I want to thank all of them for doing their part. The frequent hand washing, we cannot stress this enough. Social distancing is extremely important. I know these things are just coming kind of taglines now, but this is for real. The virus, you may not know you have it. We need to all do our part and ensure that it's not spread around. We really should be staying home, stay safe, and only travel for essential reasons. It's not time to be out socializing, going to Cornwall to get some fast food. This is for real, and we need to be able to protect our most vulnerable people in our community. And it's not just my responsibility and the Mohawk Council's responsibility. We're all in this together. This is something that we have never thought and that we'd ever have to be dealing with. But we're a strong community, and everybody must do their part to keep us all safe.
Yawagoa, thank you very much for everything that you do for our community, Grand Chief. Please pass that along to everyone in your organization. Thank you for all of the hard work for the people that still have to go to work and to perform essential services for the community to take care of their needs. They go to work so that you can stay home. So please keep that in mind always. Let's be the safest that we can about it. People always say, well, they want a quick fix. Well, can we do this to make it go away? Can we, when's there going to be a vaccine? And right now, the best thing that you could do, the best thing, of course, is to stay home. Make sure your physical and social distancing is proper, and washing your hands. Making sure that you're monitoring yourself, your temperature, 3 times a day. Those are the things that you can do. Those are the things that you can control, and that would be the best path for everyone so that we're all safe as an entire community. Grand Chief, we'll talk to you next time.
Now we'll go, Irene. Take care.